Hey, good afternoon, everybody. Can folks hear me okay? Awesome. All right, if I start to dip at all, please let me know. I also feel like I'm lunging here, but I want to get as close as I can so folks can hear me. Fun fact today, we are being filmed by Falmouth TV, so make sure you're smiling. I had my hair and makeup done this morning by myself, so I'm good to go. But please silence your cell phones. We do want to make sure that there aren't any extraneous ringings, dingings, or fun songs. So that would be great. And as folks are doing that, I'm going to try to get to know you a little bit. Is anybody here new to Medicare? Raise your hand. Anybody? Oh, we got a couple folks new to Medicare. Okay. So I have a little Medicare 101 in here for you folks who are newer to Medicare. And everybody else is on Medicare and looking to learn about 2026 changes? Who's that? Okay. All right. I would say anybody else here for the snacks, but we don't have any snacks here today either. I always love coming to Falmouth. As Marie said, I'm Kristina Whiton O'Brien. I am the Shine Program Manager at Barnstable County. I've been in this position, it'll be 3 years in April, and I'm still learning every day. We have one of our Shine counselors in the room, Janet Vacan. You want to say hi, Janet? Raise your hand. Jan is one of our Shine counselors. We have a great relationship with the Falmouth Senior Center here. Jill Bishop has been wonderful to us. We have an amazing group of Shine counselors. Who's had a Shine appointment? Okay, all right, great, thank you. So you know what I'm talking about. You know how wonderful our volunteers are. If any of you today are like, this is so exciting and I love this information, I want to be a Shine counselor, let me know. We'll do recruitment in January and we train Shine counselors in spring. So also, does anybody know how old Medicare is? Anyone know how old Medicare is? We had a big birthday this summer. 60. Medicare turned 60 this summer. So another question for you. Does anybody know who the first two people were to sign up for Medicare 60 years ago? Who? George Washington, yeah. I get that answer a lot. That is so funny. No, it was actually Harry and Bess Truman were the first two people to sign up for Medicare. So Medicare has changed a lot since then, and I'll go over that a little bit. But first, I'm going to talk a little bit about Shine and who we are. So Shine stands for Serving the Health Insurance Needs of Everyone, and we say on Medicare. So we definitely are Medicare experts. We are the ones that can assist with people when signing up for Medicare, making any changes. This is our busiest time of year. I'm the most popular person now for folks over 65 on Cape Cod because everybody wants to know about what's going on for 2026. I know there have been some letters that have come out in the mail, a lot of changes, so hopefully we'll get to that. But one of the things we also do in addition to our counseling it's also free, unbiased health insurance for beneficiaries and their caregivers. We also screen for public benefits, and I'll talk a little bit about that throughout our presentation, but there are some programs that can assist with the cost of Medicare. We are a statewide program. We're actually a nationwide program. We do get some funding, the majority of our funding from the federal government, the Commonwealth of Massachusetts, and Barnstable County heavily subsidizes. We are still working. We are not impacted by the government shutdown, although we are funded through June 30th of 2026, and we're hoping that that will continue. So across the state, we have about 700 counselors. The majority of our counselors here on Cape Cod are actually volunteers. So these are your neighbors, people in your community who just wanted to give back and who really enjoy learning about Medicare and I think kind of things that are tangled and untangling them. And we do have access to bilingual counselors. We actually don't have any bilingual counselors on Cape Cod for in-person appointments, But if somebody needs that, we are connected to a statewide network. So we help folks understand Medicare and Mass Health, what your rights and what the benefits are. We educate people about health insurance options. And we also help people with limited resources be able to understand what's available and help pay for their Part D drugs or even with the Part B premium. And I'll get into that and how we screen for both state and federal benefits. So I'm going to do a very quick Medicare 101 for those folks who are new to Medicare. So Medicare is a federal health insurance program that pays for the costs of health care. There are 3 different parts to Medicare. Medicare, though, is not comprehensive. And what I find a lot of times when I work with folks is that people are surprised at how much Medicare actually does cost. People think, well, I've worked, I've contributed to my Medicare taxes, to FICA. Why do I now have to think about paying and what it's going to cost me? We'll talk a little bit about what those costs are. We'll look at how the costs are increasing for 2026. But that's one thing I wanted to share with you all. So the parts of Medicare are Part A, which is your hospital insurance, Part B, which is your medical insurance, and Part D, which is your prescription drug insurance. A, B, and D make up what's called original Medicare, and I'll talk about the differences. Now, many of you may have seen commercials on TV with some old celebrities or former famous people, and that is usually for what's called Medicare Advantage or Part C. Medicare Advantage came into play in the 1980s when it became very popular for employer group health plans. So Medicare Advantage was something that was added about 20 years into Medicare. And it was a way that the federal government thought they could save some money by sending that Part B premium directly to the insurance company for them to manage your care. What Part C Medicare Advantage does is wrap in all of the A, B, and D, along with some vision, hearing, and dental for people so that it's a little bit more kind of holistic. There are a lot of changes from Medicare Advantage in 2026, and we'll talk about that. But Medicare Advantage is mostly HMOs and PPOs. That means that there are networks. For HMOs, you need to have a primary care doctor in a network who makes a referral to a doctor in network or for a service in network. If you're not in network and you don't get a referral, you are on the hook for that bill. A PPO allows for out-of-network coverage. It also does not require a referral. And we'll get into some more of the details about it, but there are some restrictions and different ways of the pay structure for Medicare Advantage as opposed to original Medicare. If you have A, B, and Part D, you also you've heard about a Medigap or a supplement. That's something else you would add to original Medicare. There are no networks. Any provider that takes Medicare, you can go and see, and you don't need a referral. So that's just kind of some preliminary differences of Medicare. Now, who is eligible for Medicare? Well, most people, when they turn 65, are eligible for Medicare. Actually, everybody who turned, most people who turn 65 are eligible. There were some changes this past year, actually, in who is eligible. Right now, only U.S. citizens, permanent residents who are green card holders, or Cuban Haitian entrants, or someone residing under the Compacts of Free Association, which is Micronesia, Palau, and one more place, which I can't remember. And those are the folks who are now eligible for Medicare. So a lot of people who had asylee status or visas that were contributing to Social Security and Medicare are no longer eligible if they don't fall into these categories. You've had to work 40 credits, which is about 10 years, to get premium-free Part A, which is that hospital insurance. If you haven't worked, you may be able to get it through a spouse. And if you don't have a spouse, you would have to pay for Part A. But very few people are in that boat because most folks have worked and contributed or have a spouse who's worked and contributed. Now, some people under 65 are also able to get Medicare. Those folks have been on Social Security disability income, so most folks are disabled. And if they've been on Mass Health for 2 years, they then transition over to Medicare, where Medicare is primary and Mass Health is secondary. I'm just trying to see what else. A lot of people think that when they come to Shine that we'll sign you up for Medicare. That's actually not what we do in a Shine appointment. You would sign up for Medicare with Social Security. So you sign up for A and B as your foundation, your hospital and your medical, and then you would make a decision as to how you want to get the rest. And again, we'll talk about that a little bit more. So Social Security right now, as a result of the government shutdown, they are still available to help people apply for benefits. Your best bet is to go on ssa.gov or to call and make an appointment at the Social Security office. They do not take walk-ins at a Social Security office. So a lot of people, I've actually met several people. Did you have a question? We do have a microphone for a question. Marie, we have somebody with a question. Do you want to come down front? And I'm sorry. We have a question right away. Since we are filming, we want to make sure that we get that question. So if anybody's watching, we can get the question to be heard right here. As far away as possible from you. Right here in the front row. Raise your hand, please. Right here.
I think he may have said that the Part A is free.
The mic isn't on, I don't think. So I did say that Part A is free if you've worked your 40 quarters and contributed to those taxes.
Okay. All right.
Okay, that was pretty easy. Okay, sorry.
Okay, if you have a question and you're close to this mic, I'm gonna put the mic on. You can just come up here,
All right.
and then I'll keep this mic more towards the
Okay,
back.
thank you. Sorry about that. Great. So this is again the information about how to sign up. Medicare doesn't know you turn 65 unless you're collecting Social Security. So if you turn 65 and you're collecting Social Security, they will actually automatically sign you up for Medicare. But if you're turning 65 and you're not collecting Social Security and maybe you're working, you can delay signing up for Medicare. And I'll talk a little bit about that. So here are the enrollment periods for Medicare. Your initial enrollment period is the 7 months around your 65th birthday. 3 months before your 65th birthday, your birthday month, and 3 months after. That's when you're initially eligible for Social Security. Now, a lot of people, when they turn 65, if they're gonna get Part A premium free, and maybe they are still working, will sign up for Part A because they don't have to pay for it, and it will be secondary to their employer group health plan. And they'll delay Part B. The next time to enroll would be, if you're still working, we're gonna go down diagonally to a special qualifying event. When you move, retire, if you're leaving incarceration, other types of things, a life event opens up a special enrollment period. So if you're working and you're gonna continue your employee group health coverage, you can sign up for A, delay Part B, and then when you retire or get ready to end your employment, you can sign up for Part B and the other, a GAP or Part Medicare Advantage or Part D drug plan. On the bottom, we're actually in open enrollment right now, October 15th to December 7th. So if you've been on Medicare for a while, that's the one time a year when you can make a change. And we really recommend people to not put their Medicare on autopilot. I often say to folks when they're new to Medicare, don't make this the last time you see me. Please, every year, check your Medicare, and whatever you're choosing now isn't what you're gonna have to have for life. You can make changes. Open enrollment is a time to do that. You'll also see that Medicare Advantage on the left here has an open enrollment from January 1st to March 31st. And then say you've missed your initial enrollment period, you missed a special enrollment period, you can sign up for A and B during the general enrollment period from January 1 to March 31st. Now I'm sure that's all clear as mud. It took me a while to understand this pie chart. But there are opportunities throughout the year to make changes, to sign up. But the most important thing is you want to pay attention to when you're supposed to do it, because if you don't sign up when you're supposed to, you can incur a penalty, and that penalty can be for life. So I did mention that a lot of folks are delaying Part B and Part D because they're continuing to work. So if you're continuing to work past the age of 65, or you have a spouse who's still working and you're on their employer group health plan, you should evaluate whether or not you can take Medicare Part A, and that usually the evaluation is it free? Then maybe I'll get it. And that can be that simple. However, for those people who have a health savings account, you want to think twice about that and talk to whoever does your taxes or an accountant, because there can be tax implications if you have a high deductible health savings account and still contributing. You want to pause those contributions if you're going to sign up for Part A, because there will be tax implications. So that's just something else there that you want to flag. And we do want to make sure that if you're delaying Part B, that your employer group health coverage is as good as Medicare. Now, what does that mean? Well, the golden rule for that is the number of employees at your employer. If you work for a large employer of 20 or more employees, that coverage is considered as good as Medicare. So you can continue with that employer group health plan and avoid the Part B and Part D penalties. And when you're ready to sign up for that, you can show, you fill out a form. It's a CMS L564 form. And that is what you show to demonstrate that you've had that coverage. If you don't, and your employer is smaller than 20 employees, so a lot of places are, mom and pop shops, or they are small businesses, and if you're you're self-employed, you're going to want to sign up for Medicare, because they're going to say, well, if you're over 65, you should be on Medicare, because these other policies and the number of employees is fewer than what is considered as good as. You also want to make sure that the drug coverage is creditable too. Now, some people who are veterans can get their prescriptions through the VA. That's considered creditable drug coverage. But an employer group health plan, that is also creditable drug coverage. So you are able to avoid those penalties in those kinds of circumstances. And again, those penalties are for life. I already mentioned this, but during open enrollment, which is the time we're in right now, you can make a change, and I'll talk about that. But if you have a Medicare Advantage plan and you miss October 15th to December 7th, you have a special enrollment period if you have a Medicare Advantage plan from January 1st to March 31st. So I know there's a lot of instability right now with Medicare Advantage plans. The good news is you have now, and you have the first 3 months of the new year to make a change. There are other times when you can make a change. I'll talk about prescription advantage, extra help. Anytime you qualify for assistance, that can also open a special enrollment period, and it will actually get rid of any penalties that you have as well. So, what is Medicare enrollment? That is the one time a year, and I kind of already mentioned this, when you are on Medicare that you can make a change. And it's for Part D, your prescription drug plan, or Part C, Medicare Advantage. The open enrollment period begins October 15th. It runs until December 7th, and anything you sign up for during this period becomes active January 1. So this period is important because your health may have changed over the past year. Your doctor networks, if you have a Medicare Advantage plan, may have changed. Premiums may have changed. Did anybody get a letter from an insurance company saying they terminated your plan? Yep, so that has changed. And so, you know, this is the opportunity for you to find out what else is available and to figure out what's going to be the best option for you. Or maybe your finances have changed and you were on original Medicare and it's becoming too costly, so you want to find a Medicare Advantage plan. Or because you've had a health status change and you're going to the doctors a lot, you're paying a lot in your copays and you're reaching that out-of-pocket max with a Medicare Advantage plan. So that's why you want to make a change. So it's very important, and I also want to stress, the Part D drug plans change their formularies every year. So they switch the tiers that drugs are on, they move drugs off of some of the plans. A lot of medications, you know, people, even myself, have been impacted with my employer plan of my insurance company not covering my medication anymore. And let me tell you, it's a headache and it's scary. You know, it's really unnerving. So this is the time when you want to either yourself or with a family member or come into Shine to go over what you have and make sure it's still the best plan for you. And as I mentioned, Medicare Advantage also offers another time if you miss open enrollment from January 1 to March 31st. Now, if you make a change during this time, say you make your change in January, the new plan is effective February 1. If you make your change in February, it's effective March 1. So that is different than open enrollment where you have to wait until the beginning of the year. But if you do it during Medicare Advantage open enrollment, it's effective the first day of the next month. So this is just a little review with pictures. So for those folks who are visual, Medicare is made up of parts. A and B are your foundation. A is your hospital insurance. B is your medical insurance. Now B is anytime you see a doctor, you get blood drawn, you have an x-ray, you have an MRI. B is also if you go to an infusion center and get medicine infused, like chemotherapy or biosimilars, or injected by someone else.
Immunotherapy, does it cover?
So the question was immunotherapy. So again, it's medication that is injected or infused by someone else. So immunotherapy is kind of a big category with a lot of medications. So it's how the drug is administered. Part D is typically anything you're going to pick up at a pharmacy, like a CVS or a Walgreens or a Stop and Shop or a Walmart, or if you're going to have your drugs mailed to you. That is Part D. And again, original Medicare on the left-hand side, the A and the B have gaps, and so you fill in the gaps with a Medigap or a supplement policy. And that is by a private insurance company. But the federal government keeps that Part B premium that you have in 2025, that's $185. We're anticipating that's going to go up about 11 or 12% next year. And they hold on to that money and manage your care. That's why there's no prior authorization, there's no referrals, there are no networks. Any provider that takes Medicare, you can see in original Medicare. With the other side, Medicare Advantage, Part C, that bundles together A, B, your drugs, Part D, and it gives you vision, hearing, and dental as well. But again, those are networks, those are HMOs or PPOs. There are some zero premium plans, but you pay as you go. So every time you go for a service or for an appointment, you're paying a copay, and there's an out-of-pocket max. Now in 2026, those out-of-pocket maxes, they went from like $5,000 and $9,000 up to $7,000 and $13,000, $14,000. So those out-of-pocket maxes are quite expensive in 2026. So this just kind of reviews the pluses and minuses of the different plans. And so you have to really think about, you know, how often do you go to the doctors? Are you a frequent flyer? Are you accident prone? Do you go to the hospital a lot? Do you have a chronic illness? Or are you relatively healthy, knock on wood, and you don't take any drugs? Those are some of the discussions that we have with you when you come in for a Shine appointment and the things that we look at. And we also look at your budget. Are you living on Social Security? Do you have resources? Do you have extra money? You know, what can you afford? Those are all things that we go over in a Shine appointment and all things that you should be considering as you're looking at your care. Another thing, especially with the Medicare Advantage plans, are your doctors in network. Now, a lot of folks live part-time here on Cape Cod and then live somewhere else. Well, if you're on a Medicare Advantage plan and you're in Florida and you fall and break your leg and you're outside of the network with Medicare Advantage, they'll pay for you to go to the hospital, maybe have surgery, get your leg set. But if you need long-term physical therapy, they're gonna want you to come back to your network. Now, some companies have large networks that are nationwide, but most want you to come back to the service area close to your zip code and where you live. So these are all things that you need to consider as you're making your choices and your options. So one of the ways that we help you make that decision, and we want you all to learn how to do as well, is use the Medicare Plan Finder, and that is Medicare.gov. Does anybody have a Medicare.gov account? Okay, by the end, everyone's gonna wanna sign up for one. I actually think Medicare.gov is a very user-friendly platform and really quite easy to use. The most important thing is that you remember your username, your password, and your secret question. And I will tell you, I was working with a couple, and the husband's question was, who is your best friend? And he couldn't remember if it was his wife or his dog. So it was a little embarrassing, but we worked through it. So it's really important to write it down in a special place and make sure you know how to access it. And that's probably, honestly, that's really the hardest part of the whole thing. But when you log on, if Medicare has been paying for your drugs, all your drugs will populate in the system. Because otherwise, we have to go through, and I took Latin in high school because my dad wanted me to, and unfortunately, he'd be very disappointed to know that it's not helping me with knowing drug names and what they are when I put them in. If you're gonna be new to signing up for Medicare.gov, they are gonna require a multi-factor authentication, so you will need an email address going forward, and they'll prompt you to put in another code. So it's a little more complicated going forward, but that's only for newer plans or newer people that are signing up for this. Now, this is what the home page looks like. You'll see that right up at the top, you can start to search for plans. On the bottom, you can log in or create your account. You can also just do an account anonymously. So like if you're only on one drug and you just want to know what the options might be, or maybe you're not on any medication, you could just do something really quick like that. The other thing that they're doing on the Medicare Plan Finder is finding providers for you. Now, I'm going to be really honest with you. This is a brand new feature, and it might not be as accurate as it needs to be. I'm not 100% sure. I've looked up one or two providers, but we talk about when we do our Shine training, the golden rule. If you're interested in getting a Medicare Advantage plan, you want to ask your providers, your doctors, what networks are they in? Which Medicare Advantage plans do they take? So I think, you know, in this day and age, everybody wants to rely, excuse me, on what it says online, but this is where you need to go to your provider and make sure that they're in network. One of the things they're offering is a special enrollment period in case you do look on this website with the button and it has wrong information, you will get a special enrollment period. But this is a great tool. So if you want to set up your account, you're going to need your Medicare card, excuse me, all your information, your zip code, and the date that Part A and B, or the part that they started. And then Like I said, you can create a personalized drug list. You can compare your current plan with a new plan for 2026. And it's actually a really good tool. And we'll play with it if we have time. So, I'm sorry, my voice gets very dry when I start to talk. For 2025, these are the costs of Medicare. Now, Part A, as we said, is usually premium free for people. Part A also has a deductible of $1,676. Now, the reason why I have 2025 numbers is because I don't know 2026 numbers yet. Even though open enrollment has started, the federal government doesn't give us those numbers until November, which doesn't really make a lot of sense, but it's the way they do things. So we're waiting on these. Now, the Part B premium for 2025 has been $185. I've heard and seen that it's going up to $206.50. And the Part D premiums have actually dropped on the lower end and gone up on the higher end. So the cheapest plan this year is $8.40, and that's a Humana plan that is really good with generic drugs. Last year, the winner was WellCare. That was $12.40. That went up to $16.40 this year. But this gives you a general idea. Now, some people think that if they get a more expensive plan, it'll cover more drugs. That's not true. Every plan has its own formulary. The other thing we want to mention is that Part B and D, for some folks, can have a higher premium if you have to pay IRMA. Now, IRMA means that it's an income-related adjustment. So if, as an individual, your income is over $106,000, you'll pay more for Part B. If, as a married couple living together, your income is over $212,000, you'll pay more money as well. So this is a slide I threw in there that kind of compares. So again, 2026 is projected for Part B, but we do know what Part D is. Because Part D is actually controlled by the Inflation Reduction Act. That was signed into law in 2022. So it's keeping the drug increases capped between 4% and 5%. Part B at this point in time is based on the inflation rate. So the estimate is around 11 and 12% that those Part B premium and deductible are going up. So these aren't official numbers for Part B, but that's what we're anticipating for folks to look at. So it's hard to understand. So basically, you're going to pay more in 2026. But for your Part D, you're only paying a little bit more because of legislation that was signed, the Inflation Reduction Act. But Part B is based on what inflation is, so it's a little bit higher. There's no legislation protecting that Part B premium. Yeah, you want to go up there? Give me a chance to get some water.
So from my personal experience, I think people should realize what IRMA means with increasing your payment, your premium. So
Yeah.
they go back 2 years in your salary.
Yes.
So if you just retired and they go back 2 years, you're going to be making over, if you make over $212,000, it keeps going up. So you can pay up to $500 a month for that premium. And what you have to know is there's a form, 41S, because we just did that. My wife and I were paying an extra $1,000 a year for 3 months. We found out about the form. You ask them to go back only a year, and they will decrease or eliminate that IRMA. So it's very tricky. Don't go on paying all that money if you don't need to, if you're in a high-income bracket.
So thank you. So ladies and gentlemen, I think we have a new Shine counselor here. I'm going to get your name and phone number before you leave. So IRMA only applies to a certain number of people. These are high-income earners. And so this gentleman is correct. When they're looking to assess your Part B, E, and D premiums, they're looking at your taxes from 2 years ago. So again, as an individual, if you're making more than $106,000 a year, you're gonna pay a higher Part B and D premium. If as a married couple living together, your income is over $212,000, that is also gonna be higher. Now, you're also correct in that, you know, a lot of folks, when you retire, your prior income 2 years ago has been much higher. So there is a form, Janet, do you know the form?
41S.
Oh, there you go, 41S on Social Security. And actually what happens is when they send you a letter in the mail that says what your Part B premium is, you should be able at that point in time to appeal it. So it's always good to try to appeal it, but anytime there's a life event, you know, so say in the course of your time, even if you sell a house and that bumps up your income, it could bump your IRMA so that you end up paying more for your Part B premium. Because ultimately, these premiums are subsidized, but that's why when you're a higher earner, you pay more because you have a less of a subsidy. Anything
But
else?
$212,000 is not really high income in some cases, you know. So if you were 2 years ago, you and your spouse were making over $300,000, there's a
Yep,
chart.
there's a chart. Yes, so
that
when
if
you come to a
made-
Shine
If you
appointment.
made over $400,000 as a combined income, you're going to pay that $500 more per month.
Yeah.
It's
It's gross adjusted income.
yeah, there's an
Maggie.
abbreviation for that. Yeah, it's a gross adjusted income. So anyway, just a little advice.
So if you're low income, again, we'll get to that. We're not there yet. You have a question? We have a microphone?
Just real quick, income also includes IRA withdrawals.
So the comment is income includes IRA withdrawals. Yes, so yes. So it's funny because this is all stuff we would go over in a 101, but we're doing like a little bit of 101 and a lot more about open enrollment. But you know, when you're getting ready to retire, your income is very different. So they're looking at things like Social Security, pension. If you've got IRAs or other types of things and you're pulling out of that, that's income. If it's sitting, it's an asset, and that's when if you need assistance, assets are different. But yeah, no, they're looking at all of that information. So it's whatever's on your taxes. Okay. So we've already talked a little bit about what some of those initial costs are going to be in 2026. So let me just go back. So if you remember that chart that had like the pictures on it, we're going to be on the left-hand side of that chart, which is original Medicare. So original Medicare is A, B, and D, and you need a Medigap or a supplement. You actually don't need it. You don't have to do it, but if you want to fill in the gaps of Medicare, Medigap is an option for you. Now, if you came in, one of the charts, and we have it in this presentation, is a Medigap chart. Those are all of the providers in Massachusetts who offer Medigap insurance. All of those plans, all of those companies rather, they do the same thing when it comes to what they offer. They have to by the Division of Insurance. But they cost different amounts of money, and they're at different levels. And we'll talk about that. And the premiums went up for these. The lowest premium last year was about $129. That's gone up to $142.64. And the highest price for a Supplement 1 plan is $327.25. Now, Supplement 1, also known as the Blue Cross and Blue Shield, they call it the Bronze Plan. That is only available for people who turn 65 before 2020. So if you're like new to Medicare now, turning 65, you're not eligible for this. Now what that does is when you pay your monthly premium, It picks up everything. There's no A, there's B deductible, there's no A deductible, there's no other copays, it pays everything. But you're paying a pretty high copay. The supplement 1A is actually cheaper and does kind of almost the same thing, except you have a Part B deductible of $257. Everything else is picked up. And you get additional days in a skilled nursing facility, hospital days, etc. And the core policy just picks up that 20% coinsurance of Part B. So you still have your Part A deductible of that $1,676 that I showed you in the prior slide, and your deductible. Many of these plans offer some additional bells and whistles, like hearing and vision riders. They offer discounts if you enroll early, if you enroll for a number of years. If you and a spouse enroll at the same time. So it's always important to reach out to that plan directly. So this is that chart we passed out. So again, the core policy is picking up your Part B deductible, your Part B coinsurance of 20%. The 1A picks up the 20% Part B, as well as the Part A deductible, and gives you more days in a skilled nursing facility and in hospital. The Supplement 1 picks up the Part B premium and everything else. Moving on to drug plans. So with original Medicare, you've got A, B, a Medigap or a supplement policy, or a Part D drug plan. So we've lost a few drug plans this year. There's a question? Mm-hmm.
Excuse me. So basically, you're going to pay at the very least $500 a month, right? Because you're paying for Part B and then the Medigap plan,
And a
which
drug
if you
plan.
got Supplement A is $200-something a month. So you would still be paying $500 a month.
Yeah, so when you have original Medicare, it's like I talk about it like having a supplement in a Medigap plan in original Medicare is like having car insurance. It's there if you need it. And you're paying a monthly premium. But again, you can go to any doctor that takes Medicare. You don't need referrals. There's no prior authorization. So you have flexibility. You can usually travel with it. And it's a product for people, in my opinion, if you're a frequent flyer, if you have a chronic illness. You know, if you want to pay your premium and not worry about getting a bill, original Medicare is probably a better route to go. Now, part of original Medicare is also the drug plan. Everybody needs to sign up for a drug plan, even if you're not on drugs. People say, why? Well, they want everybody in the pool, because when you're in the pool, it ultimately is going to cost less, because that means that you're going to the doctor, you've got your coverage. They don't want people coming forward and going to the doctor or needing things when it's already, you know, a real problem and going to be costly. So the idea is, if people have the health insurance, they have the insurance they need, that they're going to use it. Everybody except my husband, actually. Oh, I'm being filmed. Go ahead.
So Mark Cuban has developed this new medical where you can get discounted medications and stuff. Could you do that and not go on to another supplemental?
No. So we actually, so you need to have a Medicare Part D plan, or you need to have a Medicare Advantage plan that wraps in Part D drugs. A lot of people, and we'll get to that, we actually don't know much about Mark Cuban. We don't have information about that. And some people talk about Amazon as well have drugs. Some people go to Canada. That's not in our purview. We do know about people going to GoodRx, using those coupons, using Needy Med coupons, going to foundations or other types of resources to get assistance with paying for those drug costs. But in order to avoid a Part D penalty, you need a Part D plan. And I will tell you, I've talked to several 90-plus-year-old folks who weren't on any medication, and it wasn't really a rule 30 years ago, and now they have a medication prescription, and they're trying to signing up for a Part D plan. So it's 1% of the median cost, which is like $38.99, so that's 38 cents times every month they weren't on a plan. So if you should have signed up at 65 and you're 95, 30 years times 12 is 360 times 0.38, and that's per month for the rest of your life. So it's a lot. So it's really just a word of caution to say make sure you're signing up for that Part D plan. And again, with Medicare Advantage, you can get that, but we'll talk about that. So there are 2 plans that have 0 premium for Medicare Part D, and the deductible has gone up for Part D as well. It's $615 instead of $590, and we don't know of any 5-star plans yet. So, oh, sorry, go ahead.
Who rates the insurers?
Who rates them?
Yeah.
You do.
There's not an agency that gives some of these insurers 4 stars, 5 stars?
No, I mean, this is, the stars on Medicare.gov are based on consumers. Now, what organization, I mean, is it Medicare, is it CMS that collects all that information? Probably, but it's consumer rated.
Okay.
So this just talks a little bit about Part D and what that looks like. So there's the deductible. So there's for 2026, the deductible has gone up, as you can see, from $590 to $615. Now, there used to be the donut hole that people would hear about. So I like to say to people, like, well, you know, the donut hole went to a munchkin and now it's off the menu because the Inflation Reduction Act, it used to be you'd have to pay up to $8,000 before catastrophic phase, and you'd reach that phase. That dropped to $5,000. It dropped to $2,000 last year. And for 2026, you're capped at $2,100. So that means if your drugs are on the plan formulary and you have coverage and it's an expensive drug, the most you'll pay out of pocket is $2,100. If your drug is not on the plan formulary, you then either have to pay that cost, find another drug plan that will take it, use a coupon, or first and foremost, go to your doctor. Is there a generic you can take? Is there another type of prescription you can take? Or can your doctor file an exemption with the drug company? And hopefully they can. But, question, sorry.
Just on the prior slide, what is a 5-star plan that you're awaiting the costs? What's a 5-star
So a
plan?
5-star plan means that on the Medicare.gov plan finder, it has 5 stars. It's that simple. We didn't have any last year, and we don't know yet for 2026. And the benefit to a 5-star plan means that if the drug plan you're in that you choose for 2026, say in May, isn't working for you, a special enrollment period is if you switch into a 5-star plan. So that's what the benefit of a 5-star plan is.
Can I make another comment about medication?
Sure, Mike is yours. I'm definitely getting your number, by the way. Because I think you're a budding counselor for sure.
So I'm going to self-disclose that I'm a physician, and I currently do Medicare Advantage calls. And one of the things that you need to ask at the very beginning are medications like inhalers and insulin. I have many Medicare, they're not my patients. I have many members who are not taking their inhalers because they cost $500 a month, and they don't get them filled, and there's no other way for them to get the medication. So be very aware of what medications you are. When you call a Shine representative, find out if these medications are covered, because once you're in that plan, you're not going to get your medications. And it's very sad to see these people who need the medications not taking them. And that includes a lot of other
Yeah.
medications that are high
Yeah.
cost.
Yeah, no, absolutely. And I think, a lot of times with inhalers, I think some are over the counter that they want you to take, and the insulins, some people are on more than one insulin, and a plan may cover one insulin and not the other. So it is a bit of maneuvering to try to find the plan that will cover everything. The good news is the plan finder has been updated so that when it lists, we know right away the medication's not covered because the cost will be $50,000. And you're like, oh, something's not right here. And when you go into the plan details, it will have a big yellow, like one of those POW signs, in a cartoon. That's what it looks like. It's a big yellow sign, and it says, not covered. So it definitely says that, and you just got to do that due diligence. There's another question here.
Yeah. Insurers can change their formularies in the middle of the year, isn't that correct?
I believe so,
And
yeah.
so can you change your insurance in response to that in the middle of the year?
That's a good question. I don't think so. I think it's very rare, and that they would give you enough notice too. If we usually see the reverse of somebody, well, not even the reverse, we see a different scenario of somebody getting a new prescription that, is very expensive and not on their plan formulary. And at that point, if you can't take a generic, if you can't get an exemption, if there aren't any coupons or anything else that you qualify for, we at Shine can maybe try to find a special enrollment period for you, because we screen for public benefits, and we also, there's the Prescription Advantage program. This is for people up to 500% of the federal poverty level, which I should know that number off the top of my head, but I don't. But it's a higher amount every month that you're getting. And if you qualify, you get one special enrollment period a year. So that's kind of in our back pocket to assist people with that. So, that's kind of how that works. So there were some plans that were eliminated. Cigna was actually bought out by another company. I think it's Health something. So some plans are being crosswalked, which means that some people who have the plans will be moved into another plan. Other people, if you're going to have an elimination of a plan, you'll be able to sign up for a new plan. But if this is you, you would have already received notice from your company. I have a question in the back.
Yeah, I got a question on, I've used the plan comparison feature on the website, Medicare website, but I was only able to compare drug plans. How do you compare supplemental plans?
You don't. So Massachusetts is unique. So you wouldn't compare supplement plans. The chart that we have here is something that you would get in a Shine appointment, and we would go over that with you. You can compare Medicare Advantage plans. So Part D and Part C are kind of tied together because of the drug component plan. Medigap plans in original Medicare, now I don't want to blow your mind and confuse you a lot, but one of the things I didn't talk about was continuous enrollment. Now, Medigap plans in the Commonwealth of Massachusetts, we have continuous enrollment. So that means if you have original Medicare, you can enroll in a Medigap plan at any point in time. And so sometimes when people first get on Medicare, maybe they don't use their doctors a lot, they don't go to the doctors a lot, and they're okay paying that 20% of the Medicare allowed amount, so they don't pick up a Medigap plan. They don't go to the hospital, they're not worried about the deductible. And if they're outside of their initial enrollment period, it's not the general enrollment period. So say it's like July and they want a Medigap plan. They can sign up for a Medigap plan at any point in time. And you can actually move between Medigap plans, but that's stuff we would go over in a Shine appointment. So it's the Part D and Part C that are really tied to these different enrollment periods. See another question in the back.
So if you're going to switch insurers, do you have to let your existing insurer know that you're doing so?
Yes, great question. So again, because C and D are tied together, and you can do that on Medicare.gov, if you have a Part D plan and you sign up for a Part C plan, it will cancel Part D. Same thing with C. If you sign up for, if you have Part C and you want to get out of it and sign up for Part D, you can do that. It will cancel each other out. We have people that were on original Medicare, had a Medigap policy through, say, Blue Cross and Blue Shield, and then went into, say, a Tufts HMO Medicare Advantage plan. Unless they call Blue Cross and Blue Shield, they're not going to be bumped out of that because the systems aren't connected. So you have to, we've had a case this year where someone has been paying for a supplement and had a Medicare Advantage plan. And we see that all the time. So thank you for that question. That's a great question. All right, getting back to these plans that were eliminated. It's 2 Cigna plans and a WellCare plan. And again, if this impacts you, you would have gotten a letter. And then this is what Cigna Healthcare, all of their products, they're changing this to HealthSpring Assurance. So it's just a name change. So they acquired Cigna, and that's what we'll be seeing going forward. I haven't gone to this yet, but we do, again, screen people for public benefits. The LIS is a low-income subsidy extra help drug plan. So these are for people who have a certain level of income and assets. And there are 4 zero premium plans to choose from with reduced drug costs. So again, this is if you have an income as an individual under $1,900 a month, and you have to have about $17,000, I think, in savings. But we'll talk a little bit more about a Medicare savings program. So this just kind of gives you a sense of what premiums were for some of these companies in 2025 and what they're going to be in 2026. So you'll see that there are 3 plans that really jumped, and down on the bottom, there are about 4 plans that reduced. Now, I will say, if you look at this Humana reduction of $102 down to $8.40, so one of the reasons why a company may do this is because once a company has you signed up, they then can market to you. And Humana has a Medicare Advantage plan, but when we get to Medicare Advantage, you'll see Humana doesn't come over the bridge. So you want to be careful that if you sign up for a new plan and they call you to say, hey, why don't you join our Medicare Advantage plan? There are only 3 companies that come over the bridge: Blue Cross, Tufts, and Fallon. And we'll talk about that a little bit more. But a lot of times they'll try to upsell you on a certain thing. So you want to be very careful about that and not sign up for something that sounds like a really good plan. Now, this is just something to bring your attention to. On the Plan Finder, you'll actually be able to drill down to a particular pharmacy and medication. I work with some people who pick up one medication at Stop and Shop, another at CVS, and get mail order for the rest. So if you're really trying to, watch what you're spending, it may make a difference whether or not it's a preferred pharmacy or not for that drug plan, and you can save even more money going to that pharmacy. It's definitely highlighted on the Plan Finder. You will be able to see this. We go over it with you when we meet with you in a Shine appointment. I'm just going to kind of breeze through this a little bit just to talk about the Inflation Reduction Act, because there have been things that have been put in place to control the cost of drugs, and we definitely see that with the premium increases for 2026. We know that diabetes medication, insulin, was capped at $35. In 2026, it's actually going to be $35 or less. So that's a change for 2026. We got rid of that donut hole. The out-of-pocket max last year was $2,000. In 2026, it's $2,100. We also last year learned about the Medicare prescription payment plan. What that does is it moves your payments from going to the pharmacy and paying out of pocket to getting a bill and paying once a month. So if you're gonna hit that $2,100 cap, they're usually gonna bill you in the beginning of the year. So when you go to the pharmacy in January, February, March, you're gonna have high costs for your medication, $400, $500, $600. If that's too much of a hit, you can sign up for this prescription payment plan, and what it will do is they use what I call like a funky formula, and they spread that cost out over a year. So you go to the pharmacy, it doesn't cost you anything. You'll get 2 bills from your drug company. 1 bill for your premium and 1 bill for the cost of your medication, so that you're not kind of walloped in the beginning of the year with some really high costs. So you may have heard that, the federal government is negotiating these lists of drugs to bring the cost down. So in 2026, Eliquis has been always a big one that's been very costly for folks. Some of the insulins, so all of these have been negotiated. We are anticipating that there'll be future negotiations in 2026 and 27, and we'll see more drugs and the costs coming down as we go forward. I already touched upon this. So basically, the cost of insulin will be $35 or less, and that is only if it's on the plan formulary. So you were talking about earlier, people's having, sometimes one drug is on and one isn't. So really making sure that, when you're looking for your medication, that you're on the right plan formulary.
I should have mentioned blood thinners like Eliquis.
Yeah.
Which cost about $500.
Yeah. I haven't really seen it on the plan finder yet for this year, but the cost is really coming down with those things. I already talked about the Medicare prescription payment plan. That's the one where it spreads out the cost over the year. If you signed up for it last year, you're automatically rolled over in 2026. And if you didn't sign up and you think you might need it, you can sign up again in 2026. So you'll actually get something in the mail from your drug company, or the pharmacist will be able to sign you up for it. All right. So now we're going to talk about Medicare Advantage plans. These are the fun ones, because these are a lot of the letters that went out and a lot of the changes with Medicare Advantage plans. So as I said, and that's the Medigap. I also have the Medicare Advantage charts over here. So there are 3 companies that have Medicare Advantage plans that come over the bridge. Blue Cross and Blue Shield, Tufts, and Fallon. Those are the only 3 companies that will come over the bridge if your zip code is over this side of the bridge. Now, I'm going to go into some kind of high-level stuff with each plan. I know people probably have a lot of questions because Blue Cross and Blue Shield eliminated the 0 premium PPO. Over 47,000 people across Massachusetts got a letter. 4,700 people on Cape Cod got a letter. And I think everybody's called us at Shine. So this was something, we heard from people, they lost their insurance. The letter basically says they terminated the plan. You have until December 31st to make a change for January 1. At that point, if you don't make a change, you will revert to original Medicare, which is A and B, but you won't have a drug plan. So you need to make a change. You actually have a special enrollment period until February 28th. So you have some time to make a decision, But if you wait until January or February, you'll be without drug coverage until you sign up for it. So if you got a letter from Blue Cross and Blue Shield and you can't get a Shine appointment during open enrollment, you can yourself go on Medicare.gov, or you can try to wait until after December 7th to try to get an appointment. Now, Blue Cross and Blue Shield has 2 HMO plans, 3 PPOs, 2 HMO POSs. So what do all those letters mean? HMO means, again, I think I mentioned this earlier, you have to be in network, get a referral from your primary care doctor, you pay co-pays. They do have, I think at least one zero, it's on the chart, zero premium plan. The PPO gives out-of-network benefits. What you want to pay attention to on that chart is there's a $59 a month premium plan, and then another plan that's like $108, I probably should look, $108, is that right? So that means you can go out of network and you don't have referrals. The in-network rate you can see are co-pays. The out-of-network rates are co-insurance. So if you go out of network for an MRI with the $59 plan, it's 50% of the cost. So you really want to make sure that if you want a PPO, because you like Medicare Advantage, you like things being wrapped in together, that you're very aware of who's in network and who's out of network. And if you go out of network, how much it's going to cost. So this may be a time when either you're like, listen, all my doctors are in network, I just want the option, and the 50% is not a big deal. Okay. You also want to make note of the increase of the out-of-pocket max, and I believe the out-of-pocket max for the PPO went up to $13,900. So that means that's the most you will pay in co-pays and co-insurance. And then once you hit that cap, the insurance company will kick in and take over the rest. So the HMO POS is the third option. And what that means is you can have a primary care doctor out of network, but anything else you do has to be in network, and you still need referrals. We were just talking about, well, if they're out of network, can they refer in network? We believe the answer is yes, because that would make the most sense. But you do want to make sure that you're looking at not only the premium cost, but what the additional costs are for any other services that you may need. That chart has some of that laid out, but you can go on the Medicare.gov plan finder and really drill down into the details. A lot of people like Medicare Advantage because it gives you some vision, dental, and hearing. There were some cutbacks on the dental, and they're only doing kind of like preventative cleanings now. So you do want to make sure that you're really looking at everything very closely. Do you have a question?
I have a question about Blue Cross. I read recently in the Globe that they're ending their affiliation or in network with Beth Israel. Do you know anything about that?
So on here, Beth Israel Leahy PCPs. So Leahy's like the North Shore kind of networks. They are out of network. So you can still go see them with a PPO, but you're paying the out of network rate. The two ones, so the Beth Israel Deaconess Plymouth, I believe, is in network, but you do want to confirm that. I will tell you, so Harbor Medical is actually where I go to get my care. They're Mass General Brigham in Pembroke. They're the closest, besides Foxborough, to here. Their primary care doctors are going to be out of network as well. And then North Shore Physicians Group is also going to be out of network, but we're south. So so there are those changes, absolutely. So again, if you're in this situation, so I've had a couple people that got the letter, and people are doing all different types of things. I have one couple I work with, they're like, we love the PPO, we want to stay, we're loyal to Blue Cross, they're staying with the PPO. Someone said, you know what, I want to switch to original Medicare. I'm going to go with the original Medicare supplement and a Part D drug plan. And someone else switched over to Tufts because they wanted the HMO and their doctors were in that network. So it's going to be really important to take a close look at, who your doctors are, what networks they're in, and what the costs are going to be. Fallon Healthcare, do you have a question? You want to go to the mic?
Yes.
Just so our friends can hear on the TV.
We go to Florida for 3 months. Now, that's going to be considered way out of network, isn't it?
Probably, yeah. Again, I think it's, as when I mentioned earlier, is that if you have emergency care, you can have emergency care taken care of. So if you break your leg, they'll cover that. But if you need long-term PT, they're going to want you to come back to the network for the PT.
So none of the Advantage plans are covering out of network?
No. The PPO gives out-of-network coverage.
Okay.
Yeah, it's not easy. There's a lot of layers to this to understand. So, yeah. Fallon Healthcare is a program out of Worcester. They have a pretty robust network on Cape Cod for folks who have mass health and who are very high medically complicated. But we did find that they were very open to a lot of providers down here. Again, you want to check what your provider takes. These are HMO only products. So again, you're going to need a referral from a primary care doctor for anything with Fallon. And then Tufts, they never had a PPO down here, although we did have a small group of about 50 people who had it somehow. But they are eliminating their PPO. But they have several HMO plans, and those premiums range from $0 to $255 a month. So again, you want to go into the Medicare Plan Finder and double check what the benefits are, the out-of-cost, the out-of-pocket costs, et cetera. Now, a lot of these Medicare Advantage plans were giving flex cards. They were loading money on it for over-the-counter. They have reimbursement for eyeglasses, other things. They're going to be alerting people about midway through the year of what you have left so that you use it. If you don't use it, you'll lose it. I mentioned this earlier. If you use the Plan Finder to sign up for a Medicare Advantage plan, and you search on the Plan Finder for your doctor, and you go to the doctor in February and they're not in the plan, you'll get a special enrollment period because the information was wrong on the Medicare Plan Finder. So now, this is the other thing I talked about earlier where we screen for public health benefits. So for some people, if you can't afford the costs of Medicare, if you're choosing between paying for your groceries or paying for a prescription, there can be help for you. Mass Health is always there, particularly for people who have disabilities or who are going into long-term care. We screen for that. We know what the limits are and the assets and the income. The Medicare Savings Program is actually something that's very beneficial and has a lot of flexibility with, and I have some slides about that. Extra help is for your drug coverage, and that's something that's also part of Medicare Savings. I talked about Prescription Advantage as a way for people who have up to 500% of the federal poverty level. If you get a new prescription in the middle of the year and you need a special enrollment period, we can help with that if you qualify for Prescription Advantage. And then there are some manufacturer plans, needy meds, other types of plans that we can talk about. So the Medicare Savings Program was something also known as the Mass Buy-In Program or Senior Buy-In. There are 3 different levels, and basically all of these levels, if you qualify, will pay your Part B premium, which is $185 this year, and we're thinking about $206.50 next year. It will also give you automatic extra help, which gives you an opportunity to get one of those 4 zero premium plans and reduce your drug costs to very lower copays. And if you qualify at the QMB level, or QMB as we call it, it will also pay your deductibles and your co-insurance and kind of act like a supplement. So it can be very generous. And the good news is they don't look at your assets. They're only looking at your income. So what I say to people, if you're an individual and your income is under $2,935 or floating around that, it might be worthwhile to apply. As a couple, if your income is under $3,966, that will also qualify you for the Part B premium and the extra help. For the QMB, you can see the numbers are a little bit lower, but that again is the most generous option where it will pay for your co-pays and co-insurance. So this is something where if you think you might qualify, you can call Mass Health and do an application over the phone. It's super easy. They just ask you your income. Or we have applications at Shine, or you can go online and do an application there. So right now, this program is still available. There was some information in the bill that was signed this summer on the federal level that's going to make it harder for people to qualify for this. But right now, in Massachusetts, we are really trying to get people to get on it as soon as possible. So this just, again, tells you how to get on it. There's the number for Mass Health, and this is like a little snapshot of what the application looks like. We work very closely with the Mass College of Pharmacy. They're another organization that can help. I had a counselor email me about some really expensive medications. They've been really great. Sometimes you might have, I had somebody, they were getting like a migraine medication and it was 12.5 milligram pill that they were taking. And it was blowing up the plan finder and we couldn't find anything, and I reached out to these people and they found a good RX coupon. And it was a lot cheaper. So they're a great resource that anybody can access. Again, I mentioned GoodRx, Single Care, Needy Meds. These are all the programs that we have had some experience with. We have not had experience and don't get trained on anything with Mark Cuban or Amazon or those, or going to Canada. We don't really have any information about that. I did mention about this HR 1, also known as OB3, or the Big Beautiful Bill. We talked about Medicare eligibility in the beginning. So it was Micronesia, Marshall Islands, and Palau that are part of the eligibility. The other thing is that if you do qualify for Medicaid, Mass Health, or a Medicare savings program, every year they would check your eligibility to see if you were, redetermine your eligibility. Going forward, they're going to be doing it twice a year instead of once a year. So our takeaways are: don't miss deadlines. Make sure you sign up when you need to. If you've been on the Health Connector and you're transitioning at 65, make sure you do that at the right time. Check your doctor networks. Make sure all your medications are on your plan formulary. Sign up for your own Medicare.gov account. And remember open enrollment and the other special enrollment periods. So this kind of comes to, these are other resources. Jill will have these handouts and she'll send them out to everybody. That kind of concludes this. I'm happy to stick around and talk about some things. I can't really get into too much of personal information. If anybody wants to stay another 10 minutes, I can do like a plan finder demo. I saw one question here and then a question here.
The Medicare Advantage plans have various maximum out-of-pockets, which gives me some security when it comes to the worst-case scenario of Medicare medical bankruptcy.
Yeah.
Do the Medigap plans have anything like that?
No, so with Medigap, you're paying a premium, and then it's covering everything else. So it's not, so So the most you will pay is your premium or a deductible, depending on the level of the policy you get. So
Thank you.
you should be able to know what your yearly cost is going to be if you kind of add up your premium with those deductibles.
Got you. And in terms of hospitalization?
Yeah, so for the Medigap plan, for the core policy, the only thing the core does is pick up the Part B 20% coinsurance for your medical outpatient. You still have that inpatient deductible. We don't know the number yet for 2026. For 2025, it's $1,676. And that's every 60 days. So if you're someone who goes into the hospital in January, you come back, you go back in June and come back, those are two different periods. You're gonna get two different costs. The Supplement 1 allows you to pick up that Part A. So you're paying a little bit more in your premium, but it's covering your inpatient deductible, gives you some more days in skilled nursing facility, picks up that 20% co-insurance for Part B, and you still have the deductible for Part B.
Thank you.
Oh, you had a question, you want to go up to the mic? And then we'll get to you. My new shine counselor. What's your name?
Philip Adamo.
Philip, nice to meet you.
So one of the other things for personal experience, when you're transitioning to Medicare, and you probably have seen this with your other insurance, do not pay a bill from a provider, hospital, or anyone unless you have gotten an explanation of benefits. Your bill should reflect, one, what the doctor or provider is asking for. Let's say it's $1,000. Medicare allows $800. Medicare paid $300, and your supplement paid the rest. You do not have to pay, one, up to $1,000 because Medicare only said they're only allowed $800. If you receive a bill that has none of that information, don't pay it. You're probably all like me, we get a bill, we pay it. And I found out that my provider did not even go through Medicare. Well, they went through Medicare, Medicare denied it, I wasn't told that. So if you go online, you'll see what Medicare has received as a claim. So be very careful, because once you have given that provider or hospital the money, you're not going to get it back. Okay? So please, please, please be very careful.
Yeah, that's the other plus of having a Medicare.gov account, is that you can go in and see your what you've been charged, what Medicare allows, et cetera. So yeah, so it's a really good tool to get into that. So we have a question here.
Yes, you said this was being taped.
It is.
When will it be shown?
Marie, do you know? I don't know. Yeah, I don't know.
I think I could use a second go through.
I know. Marie, we have a question over here in the back, and then this gentleman up here in the green.
Just very quickly, can we access these slides anywhere?
Yeah, so Jill will be emailing those out. I'm going to email her the slide deck, and she'll send those out to everybody. Yeah, you'll have them. That was my question. Oh, that was your question? Yeah. Yeah. A question over here.
For those of us who have lost the Blue Cross Blue Shield, Mass, Eric's, I noticed that you brought up a similar plan coming up. Without going into it, it was $59 a month. There was also another plan on the same line, which is $108 a month. What is the difference between those two?
Yeah. Oh, no. Let's see. Let me try to do. So I'm on the plan finder right now. I'm going to search for Medicare Advantage plans. I'm going to say I don't get any help. I do want to compare, but I'm going to say I'm not on any drugs. I'm not going to do a provider search. So this is the HMO Blue. This is, oh, actually, you know what I'm going to do? This is the PPO. And here's the other PPO. So this shows you like the differences here. So you'll see what the deductible is for your health. You'll see the drug deductible. You'll want to compare the maximum out of pocket. So with the $59 a month, your maximum out of pocket out of network is $13,900. In network, it's $9,250. For the $108 PPO, it's $10,000 out of pocket max for the out of network and $6,600 in network. You'll see that you're paying a portion of the premium for health and drug, and then you can kind of compare the different things that they offer. You'll then go down to look at your primary care doctor, and the most difference here you'll see is between the out-of-network coverage is 50% co-insurance for the $59 plan, and $108 plan is 40% co-insurance. You'll also want to see how they do their inpatient hospitalization. It's very different than original Medicare. With a Medicare Advantage plan, you pay a per day rate instead of a deductible. So you'll see for the $59 a month plan, your per day rate is $388. For the $108 plan, it's $433. And if you go to an out-of-network hospital, you're paying 50% of that stay and 40% of the stay with a Medicare Advantage. So even if you were on original Medicare, you're still with your deductibles, you know, so, and a daily rate after the first 20 days. Do we have a question?
I have a question about Medicare Part D.
Yep.
It's my understanding there are 11 possibilities for Barnstable County. And I was under the impression that if you signed up with a new one, you already had a plan and decided to go with another one, that the new plan would inform the old plan that you were now with them.
Yeah, with Part D.
Or do we have to call our old company?
No, so for Part D, so remember, D and C are connected, and that means D is all connected and C is all connected within it. So if on the plan finder you switch into a new Part D plan, or even if you call the company and you sign up for a new Part D plan, it'll automatically boot you out of the old plan and cancel your old plan for Part D. I have another question up here. You want to go up to the mic? Outpatient hospitalization. So for the HMO POS, it's a $350 copay. And then for the $59 a month plan, it's a 30% coinsurance in network and 50% coinsurance out of network. So outpatient hospital coverage. So that's like outpatient surgery, I guess. In network is a $300 copay. Out of network is a 40% coinsurance.
So what's the difference between that top line on that one and the one on the far right?
So you're looking, so the top lines are in network, and the bottom is out of network. So if you're going to an in-network provider, you'll see that the PPO, the $59 one has a 30% coinsurance. The 108 one has a copay. So it's a difference between paying a coinsurance versus a copay. It's what they decided to do. Yeah. The question back here?
Yeah, I just want to know, is there a problem, like say this year for 2026 you decide to go with Medicare?
Original Medicare.
Yeah, out of a Medicare Advantage plan. And then 2027 you decide you want to switch into a Medicare Advantage plan.
Yeah.
Is there any problem with that, with Medicare switching in and out?
No, so in Massachusetts, we're very lucky. You know, we are governed by the Division of Insurance with all of our policies. There are no pre-existing conditions. There are no restrictions on that at all. And as I said earlier, there is with Medigap, the continuous enrollment. So you can move very easily month to month with Medigap policies. C and D are the ones you really have to watch out for because of the drug and the Medicare Advantage. But you're not discriminated against. I mean, you can still make the changes. You just can't do it at any point in time. And we have one more question back here.
Hi, thank you for leaving that up. I have the Medicare PPO Blue,
Okay.
and I've had that for over a year, and I've been on Medicare for a while. But recently, I had to go get an MRI at Brigham and Women's in Boston, and the copay was $250. I went, wait a minute, that's a little expensive, and that's first time it's been out of pocket over $250. Usually it's a $40 copay.
Yeah.
So what changed? Is Blue
Well-
Cross going out of business, or are they just ending things?
No, so if you look at, so diagnostic tests and procedures, MRI, they're all copays. It's $375 for a copay. I know that's next year, but it was probably very similar last year.
Oh, okay, yeah, I
So
have to
they
get
do
one
charge you
next year.
copays, so that's what you have to worry about.
Okay, thank you.
So Eliquis would be a negotiated drug for 2025. 2026.
Here you go. Other locations to make an appointment with Shine Professional?
So
'Cause
I understand
this-
there are a few appointments left here in Falmouth. Otherwise, we're pretty booked everywhere. Outer Cape Health Center in Wellfleet has appointments on Mondays. They're a new center for us, so they're booking up now. Yeah. 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 Well, you're lucky if you got one, so you keep it. Yeah. All right, that's it, I guess. Thank you, everybody. Thanks for staying.